Now it's time for perspective on the programme. And two more countries, the Dominican Republic and the Czech Republic, recording their first infections of coronavirus. Two more countries, Australia and Thailand, reporting their first deaths. That is the latest figures show now. More than 88,000 people have been infected in more than 60 countries, with more than 3,000 deaths in total. Now 42 of those new deaths in China, but all in Hubei province, the centre of the outbreak. Well, joining me here on set today to talk about it in perspective is the Director of the International Affairs for the Pasteur Institute, Pierre-Marie Girard, who's also former Head of Infectious Diseases at Saint-Antoine Hospital. Thanks very much for coming in and talking to us today. I wanted to start off talking about the Pasteur Institute. I mean, the Institute itself, of course, is named after Louis Pasteur, who made some of those crucial breakthroughs of his time. Since then, the Institute continued to make a series of breakthroughs in vaccines for a whole series of diseases and viruses as well. And I know you've been working on coronavirus. I mean, if you can put it in layman's terms, what do you think you've been able to achieve so far?
Well, so far, at my position involved in the network, the international network of Pasteur Institutes, we coordinate the response to the epidemics since the very beginning, which was, we know, the last day of last year. You know, that was the first case which was diagnosed in China. So as we have our network with 32 institutes in the world and 10 institutes in Africa and 7 in the Southeast region, so our duty was very quickly to make available the diagnostics tests. And we had the chance that the Hong Kong Institute, Pasteur, developed very quickly, as well as 2 other groups, the tests. So our first duty was to make it available in all the settings where the epidemics could arrive.
And do you think it's being used in those centres? I mean, you mentioned Africa there. A lot of people are saying 1 case in Nigeria and a couple in Algeria. I mean, surely that can't be the true number of figures.
To be honest, it's a mystery. We don't understand. We don't know. There are several possibilities. Maybe one that the epidemics is there, but at very low level, and we didn't see yet. That's possible. Maybe it's the most possible option. The other possible is that there is a kind of resistance for the entrance of the virus. That's very, very unlikely. We don't even know what to imagine, any kind of resistance of the individuals, genetic factors. That's very, very unlikely. The third options could be that actually when the epidemic started in China, there were very quickly some restrictions for passengers going back to Africa. And 1 million of Chinese people are living on the continent. So maybe it's just putting forward the epidemics which could arrive now, because they kept for two weeks the people who wanted to go back to Africa and just to have a quarantine, as you know. And maybe now we are at the end of this period, and now they will come, because the other problem is that at the beginning, the center of the epidemics was in Wuhan, as you know. But now the epidemics is in Europe, in America also a little bit. So people who could infect other people in Africa now will not come from China.
So you don't think then it's because the tests aren't getting there in the first place, the tests aren't being done?
That's, of course, a possibility, because we don't have the access to the tests is, of course, much more difficult in the settings than in rich countries. But I don't think it can explain that.
And what about your colleagues at the Pasteur Institute? I mean, presumably they're also working actually on developing a vaccine.
Of course.
I mean, how close could we possibly be to that, or is it impossible?
Well, it's not only vaccine. We always talk about vaccine, but we must know that to develop a vaccine and to put it on the field, it needs at least 20 months. So everybody thinks that before 20 months will be at the end, hopefully. But we have much, much more to do to know the virus very well, to develop new tests, to develop different tests also to measure the antibodies, which is a mean to detect people who has been exposed without developing a disease. And that's very important to control the epidemics. The immunology, how do the patient can fight the virus. That's very important because it's quite a new virus. We knew another coronavirus, which was the SARS virus 15 years ago, but we have many, many things to understand how it works, how it replicates, maybe the treatment would be more.
You talk about fighting that virus. I mean, what's your feeling? I mean, hearing everything that you hear, obviously you've probably heard nothing else for the last few weeks, I would think, about where this is going to go. I mean, some people are hoping, for example, that with the summer months coming in the Northern Hemisphere, that might help kill it out, if you like, as happens with the common flu.
You mean what we call the reservoir? Or
no, what's your feeling about where this is going to go? Do you think it's going to calm and dampen down, or do you think it's going to get far, 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 far?
No, I think, well, usually this kind of epidemics, you have a peak. It will climb, then naturally, but we don't know when, it will decrease because many
people... But it's impossible to know whether that's a couple of weeks ahead, couple of months, a couple of years.
We know it's not a couple of weeks. It's not a couple of weeks. At the beginning, a very nice study from London showed that maybe the peak would be end of April or beginning of May. But you have many, many factors that can influence the decrease of the peak. So really, we don't know. For example, we have some good news from China since 1 week, that there is a lower level of new cases each day. But at the same time, you have a huge huge number of cases in Europe. So really, it's not under control right now.
Good to have you with us on the programme today. Thanks very much for coming in. Pierre-Marie Girard from the Pasteur Institute in Paris. Thanks very much.
Thank you.